people in the poorest areas live 7 to 9 years fewer on average than people who live in a rich area.
Even if you're purely self-interested, you're better off living in a society that is more equal that way. Because when people are deprived and they are suffering, they're unhealthy, and it leads to all sorts of problems, lack of productivity, crime.
Exactly. Yeah.
And just all these sorts of social problems that will cost all of us in the end.
Stories, labels, misconceptions. NHS remains a blessing. Created in 1948. We want it to remain great. A podcast where we share our stories, explore solutions in all their glories. They say it's broken, but it's not done. With your hosts Val, Barrett, and Dr. Jeremy and the Sun.
We often talk about the NHS being for everyone, but is it really? What if your postcode, income, ethnicity, or even your accent determine how healthy you are or how long you live? I'm Val Barrett, and I'm joined as always by
Dr. Jeremy Anderson,
who is a clinical psychologist who works within the NHS. Welcome to Stories, Labels and Misconceptions. We are doing a health inequality series. This is part 1 of multi-part series of 6.
In today's episode, we're beginning a new series looking at health inequalities in the UK, what they are, how they're measured, and why some communities are systematically left behind. The first thing to think about before we talk about inequalities, what is health generally? Although health is one of those words that we use all the time, it's actually surprisingly difficult to define, and it's had several different definitions over the years. So for a long time, we used to just think that health, like to be healthy, is just to not have a disease or an injury.
Yes,
so if you didn't have a cold, you were healthy, right?
Mm-hmm.
Or you didn't have cancer, you were healthy. If you didn't have a broken leg, you were healthy.
Yeah.
But when you start to get that, there's more to it than that. So maybe you don't have an illness or an injury, but if you cannot do a push-up compared to someone who can,
I'm in that group.
then maybe you're less healthy than someone who can.
True.
So health is, and part of it is not having an illness or injury.
Yeah.
There are healthier ways of being in the world, whether you have an illness or an injury or not, right? For example, people with long-term health conditions, there are ways for those people to be healthier or not. And beginning in 1948, the World Health Organization came up with a new definition of health. They talked about physical, mental, and social well-being, not merely the absence of disease. It breaks with a biomedical model of disease. We started to see the biopsychosocial model of health or disease. Biology is part of it, but psychology and your social setting is also part of what constitutes health. It's a vague definition. Now it raises the question, what is well-being, right? And the point is that health can have several different definitions, but it does refer to this notion of well-being, especially associated with normal functioning, the absence of disease or absence of pain, but it also includes mental pain or injury. And when you think about health more broadly, what does it mean to be healthy? There's a lot of different things that contribute to whether or not you're healthy. So I don't know, what do you think contributes to health?
When I look at social health, it's about your ability to interact with others.
Exactly.
And it could be about where you live, how you live,
exactly,
how much you earn.
Yes.
We know that throughout the series, we're going to touch on things like income inequality and postcode inequality. That impacts outcomes.
Someone might say, what does income have to do with health?
It has a lot. It has a lot to do with health.
I think it does, because the kind of income or job that you're doing has to do with the working conditions. If you work in an office,
Mm,
you have a different kind of exposure to things that affect health than if you're a coal miner, right?
yeah,
So the physical environment you're working in, the social environment, whether you feel supported by the people around you,
yeah.
kinds of relationships, education and literacy are important. If you can't read the prescription on the medication bottle, it's
Mhm.
difficult to keep yourself healthy.
Average
Yeah.
age of an adult in this country, average reading age is age 12?
Yeah, that sounds about right.
Something like, yeah.
Yeah.
So it is pretty low.
Yeah. All these social, educational, occupational, physical environments we live in, as well as things we can't change, our biology or our genetics. Yeah, we've talked about sickle cell disease on this podcast a lot. That's a genetic condition. People are inheriting that. There's nothing they can do to change that. There are treatments for it now, but there's people's ethnicity or their genetic profile can put them at increased risk for certain health conditions or affect their health.
We're gonna get
Um,
into that in episode
yeah,
3. So we just
absolutely.
stick to what is health. I think we've
Sure.
covered that.
Right.
That it's not just physical, mental, social being.
Yeah, I think so.
It's
And
not
so,
just people only see doctors when they're in extreme pain. Yeah,
absolutely.
you
And,
know?
and some factors people don't have control over. And some of
Yeah,
of these things people do have control over.
yeah,
So when I was training, the number one killer was heart disease. And now it's cancer.
yeah.
But that came about, number one, because people were living longer. Part of it was the treatment for heart attacks got better. But also, we realized that factors like diet and exercise were crucial to reducing the incidence of heart disease. So the incidence of heart attacks and
Mhm,
stroke
mhm.
went down. People aren't dying of heart attacks, they're living longer. As you get older, your risk of cancer goes up. So at the same time that we're lowering people's risk of cardiovascular disease, more and more people are just living long enough to get cancer. Now, cancer has overtaken cardiovascular disease as the number one killer.
When I had my heart attack, I was in shock
Yeah.
because A, I'm not obese. B, I was going to the gym.
Hmm.
Okay, I wasn't eating the lettuce every single day, but I wasn't eating a takeaway every single day.
Yeah.
When I read all the information about who's likely to have a heart attack, I
Hmm.
didn't fit into that box.
I once had a friend in Canada who came from a family of six brothers. Five of his brothers had all died by age 35
Ooh,
of heart disease. Now, that's
yeah.
extremely young. And his men in his family were very prone to cardiovascular disease. He was the only one lived past 35. It wasn't necessarily that they were eating pizza and fried chicken every day,
A burger.
right? Yeah.
What are health inequalities?
Yeah. Health inequalities. This is my AI overview because it's been 20 years since I cracked a textbook on health psychology. Obviously, there's different determinants of health and social determinants of health, and health inequalities are specifically the avoidable or unfair differences in health outcomes between different groups of people. You can see that they won't have exactly the same health outcomes. And
Mm-mm.
there's many different factors involved, some of which are controllable, some not. But at least amongst the ones that are controllable, there are different social policies or government policies
Yeah.
or structures within a given society that can either exacerbate those differences or can lessen differences and make them more equal, right? When we talk about inequalities, it's important to think we're not claiming that everyone must have exactly the same health outcomes, but among the determinants of health we have some control over, we want to make sure we're doing
Mhm.
something to make it better, not worse.
When we look at different groups, you're more likely to live longer in Kensington and Chelsea than in Blackpool,
Okay.
irrespective of how you probably take care of yourself.
Hmm.
Sometimes the factor is determined on postcode, accessibility to good healthcare.
Yeah. So a geographical difference, right? Literally where on the map you live has an impact on average how long people in that area live, right? It
Hmm.
doesn't mean that every individual is going to not live as
Oh
long or
no.
live
Oh
longer or
no, no,
whatever.
no.
But just on average, it means that people living in that area maybe don't live as long or don't have as good health outcomes. The question is, what factors contribute to that difference? Maybe if people in one area, you've got access to healthcare, if you
Yeah.
have to travel further to access healthcare,
Yeah.
you have access, but it's not equal. If you have to jump through more hoops to see a GP or
Hmm.
get to a hospital or get to an A&E or the ambulance, wait times are longer, that will have over time in aggregate, that will have an impact on people's health. If people in one area live next to I don't know, an industrial plant, so it it pollutes the water, right? So if your drinking water is contaminated, that's not as clean, you're exposed to things that impact health. If the air quality is poor, you're probably going to have more cases of asthma or obstructive lung disease or even preventable deaths from
Hmm.
respiratory conditions.
Yeah.
Some of these things are not preventable, but some really are. Right.
But we look at areas that are deprived.
Yeah.
Kensington and Chelsea, I think people have the assumption that it's a very affluent area to live. Yeah, it is. The south of the
Hmm.
borough is.
Hmm.
But when you go to the north of the borough, when you go to Notting Hill, Ladbroke Grove,
Hmm.
you've got that long road.
Yeah.
On half of it, the neighbourhood is deprived. The other half isn't, but it's still on that same road. So it's a
Hmm.
road leading
Hmm.
towards Holland Park and Notting Hill. As you can imagine, the house prices are high. You've got the rich living there. So a lot of health inequalities is not just postcode,
Hmm.
it's pockets of areas that are deprived within that postcode.
Right.
Because one thing people will say, oh, you live in Kensington and Chelsea, and they think everyone's rich. No, there are areas, pockets of deprivation
Hmm. Absolutely. Yes.
in the London borough of Kensington and Chelsea.
Of course.
People seem to think that because I think it's the majority is wealthy, that kind of drowns out the fact that there are small pockets that are not so
Yeah.
wealthy.
Yeah. The word deprived or deprived
Oh, I
borough,
hate
it is a very
it's a horrible word.
UK, like
It
before
is. We
coming here, I
like to
never heard of
use
that,
we
right?
like to use words like deprived.
Yeah.
What else is my hateful word? Hard to reach.
Hard to reach.
I hate that bloody word. Have you heard of that word?
That the expression of
Hard to
someone is
reach.
hard to reach.
Oh,
What does
how
that?
can when they write all these reports
Yes.
and they say certain section of society, they're hard to reach, bloody hard to reach, where people are.
I
Because
can
they
imagine.
always put the emphasis, the people, just like bed blockers. It's
Yeah.
their fault
Yeah.
they're on a ward. It's
Right.
always the word is put on the emphasis of the people. So when government or local authorities say, oh, that group is hard to reach, we're trying to provide the services, but they're hard to reach forever. It's a travelling community, ethnic minorities,
Hmm.
learning disability groups. They say we're hard to reach. No, you have to meet them where they are. They shouldn't have to meet you where you are.
Yeah. Yes.
You
Exactly.
the ones providing the service. When you write this area is deprived, it's deprived because you've deprived it. You have starved it of essential services that it needs to help the community to have
Yes.
better health
Yes.
outcomes,
So I've
better
actually.
educational outcomes.
Yeah.
All this
Yeah.
impacts on people's
Yeah.
lives.
I've honestly felt a bit confused when you asked the question because I'd never heard the term hard to reach referred to a group of people. Like my understanding
Really?
of the expression hard to reach, it would be like if someone doesn't answer their phone when you call them, they're hard to reach, right? They're hard to get a hold of,
For ignoring you.
right? Yeah, you're hard to reach. And maybe that really is on them just not wanting to
Okay.
talk to me. But in terms of describing a whole group of people as
Mhm.
hard to reach, I think there's a problem when the onus is put on the
Yeah.
people being served to do the reaching.
And
Um,
people don't access services.
yeah,
Ethnic minorities are least likely to access. Do you know how many service
yeah.
doors I've banged on?
Yeah.
And
That's another.
I don't receive, but they
Yeah.
say I'm not
Yeah.
accessing. I'm accessing, so I'm not receiving. What do they mean by accessing? What do they
Yeah.
really mean? Because if it means, do I know where that service provider is? The answer is yes. Have I been in touch? Yes. Have I received services from said service provider? The answer is bloody no. So why say I have an issue as a person of colour accessing services? I don't. The issue is you are not providing the
Right.
services because you always come with barriers. Oh, you can't have
Right.
it because X, Y, Z.
So let's give an example of
Mhm.
someone, they come to this country and they don't speak the language.
Yeah.
So they've got a GP surgery area, they're
Mhm,
registered,
mhm.
but maybe
Yeah.
they don't really understand what they're being told. They may be educated, they understand written language, but maybe not in English. These are barriers to accessing, and
Yeah.
I guess that person is hard to reach because the services are not offered in the language. So let's say someone comes from France and
Yeah.
there should be French translation or signs.
It costs a lot to have services translated into various languages. I'm not saying it's right or wrong. I'm
Yeah.
just saying there's a cost. When
Yeah.
I worked in the NHS,
Yes.
and we had a policy that we didn't allow children to be the translator for their parents.
Okay.
Often, when it comes to health issue yourself, there are words that are used that are
Hmm.
complex. Does the child understand that word? What do we know that they're actually translating? That the information is absolutely correct. Do you see what I
Yes.
mean? So we would
Yeah.
have to get a professional translator in.
Hmm.
Because 9 times out of
Yeah.
10, you'll have families going to the GP, bringing their children along to be the translator.
Hmm. Maybe we should spend more money, or with the advent of AI, this might be a problem that could be solved, right?
Exactly, this money is spent there. So it's like, what is priority? We know
Yeah.
the waiting list is long. We know
Yeah.
that through COVID, they're probably still playing catch up. And we know that people were probably living in cancer, weren't being treated. So there are still a lot of issues. Each borough or each NHS trust
Yeah.
provides language services.
Yeah.
Whether they will cut back on that because they need to provide more social care. Don't forget, every
Yeah.
part of health is starving. We're
Of
going
course.
to be losing workers soon in social care. We'll have to cut back. What are they willing to sacrifice?
Today, my wife was reading an article from The Guardian. The Labour government is postponing their child poverty
Yes,
initiative,
saw
right?
that.
They just don't have enough money to pay for it. Key
Mhm.
plank of their manifesto, right?
Mhm.
This is actually relevant to health,
Of course it is.
because early childhood development
Mhm.
and poverty in early childhood has a knock-on effect throughout the
Of
person's life.
course. Of course.
These, it's always kicking the can down the road.
And it makes it
It would be
worse.
cheaper to deal with it now. It just costs more money later.
We know that, but we're going to be talking about common
Should.
sense solutions
Yes.
in part
Yes.
5. It sounds
And
easy, but then
yeah.
why can't it be easy? Why can't it be black and white? This area is deprived. We
Yeah.
know in areas like Kensington and Chelsea, people live longer. I'm going to be around for a long time.
Hmm.
Blackpool, they don't live as long. How can we get Blackpool to be like Kensington and Chelsea? What's going on in Kensington and Chelsea that
Yeah.
Blackpool doesn't have?
To have a deprived borough and a resourced borough, that is a
I
choice
don't know.
in how we structure our societies. So if we want to have some areas that get the resources because it's based on their local, I don't know, their tax base, versus saying we want to share the wealth and make sure that it's a consistent level of coverage no matter where you live, that's a choice we make, right? An example of this is with schooling, right? You could say that you pay for schools by, I don't know, property taxes. So expensive real estate means better schools for the people who live there. The
Mhm,
rich people
yeah.
get good schools, And the people who don't pay a lot of property tax because their property is not worth as much get bad schools.
Yeah.
Or you could put all the tax money into a central pot and make sure that all schools get similar funding, right? That's a choice governments make. I think it's the same with healthcare.
Put it this way.
Mhm.
When we look at local authorities,
Yes.
when Grenfell happened in Kensington and Chelsea had a surplus. They had money. What? They had. So imagine
Mhm.
if it happened in a deprived borough
Okay.
that didn't have the resources that Kensington Chelsea had.
Mhm.
All that money spent on hotels and whatever.
So they were able to house people
Yeah, they were
in temporary
able to
accommodation. Yeah.
do things quickly.
Mhm.
But imagine if it was a borough that didn't have
Yeah.
anybody, that were completely broke, like Birmingham.
Yeah.
No.
Yeah.
Suppose that happened there.
Yeah.
So another thing we have to look at as well, how are each of these councils managing their budgets? In Kensington and Chelsea, they make money from parking fines. Where I live, you can't park out here until after 10 at night. Unless you're willing to pay a couple of quid an hour. I've noticed certain resources are at the north of the borough,
Yeah.
not at south of the borough.
Even though you're in the same borough,
Yeah.
one group has to travel further.
The most deprived wards in this borough are North Kensington.
Yeah.
So you'll find more resources that end of the borough. One thing I must admit that's really good here, they've got the youth clubs.
Yeah.
My son was going to one. We had no problems with transport, getting him to college, getting him to school and that. Looking after carers, they're very good. So there are things that they do very well. I'm sure they're not all singing or dancing, but there are things that we've managed to get here
Mhm.
that we didn't manage to get when we lived in another borough. There are differences. I lived in a borough
Yeah.
deemed as deprived. When we moved here,
Yes.
I noticed the difference.
I've talked to patients who they get referred for mental health services in the community. Some of them get told, okay, it's a 2-year waiting list for that.
Yeah,
And I said, why is it a 2-year waiting list?
yeah,
And the person just says, it's a deprived area.
yeah.
And what that means is if it's deprived, if the income
Mhm.
level is relatively low, those people have more health problems. They need more
Exactly.
help.
You would think
But
the help would be
they're
there.
simultaneously less likely to get the help they
Exactly.
need.
They're shoveling snow and it's still snowing. They're not getting anywhere
Mm-hmm.
because you're deprived. You need something, a service to make your health better, whether it's mental health, physical health, whatever it is. But they're
Yes.
telling you there's a waiting list of so many years, which is going to make your life worse. But yet they
Yeah.
know the area is already listed as deprived, which means it's urgent.
Yeah.
It needs resources. It's on red alert.
Yes.
But for somebody to come back and say it's deprived is an awful thing to say.
As if that was an
I wouldn't-
explanation. It's just a description. It's
Oh,
just
okay.
a restating of the same thing I said. Okay, it's a 2-year
Yeah,
wait. And I say why. Saying it's deprived doesn't actually explain. Why is it deprived? Because it's a 2-year waiting list.
that isn't a reason.
It's a circular restatement.
Doesn't make sense. If anyone said that to me, I'd stand there and say, no.
Yeah.
I want to know why. What are you doing to make it better? What are you doing?
Mhm.
It just seems like deprived areas will always be deprived.
The
This is new.
system, no,
This
and
is
it's
not new.
yeah, nothing changes. Nothing will change. Like
I remember a friend of mine said, don't live in a Labour borough, even if you're a Labour voter, because they feel the cuts more. When there's a cut,
Yeah.
Labour boroughs feel it more. Isn't that weird?
is that because Labour voters tend to have lower incomes?
It's just strange. It really is, because the most boroughs that are deprived
Mhm.
are mainly Labour controlled. Yeah. You know what was funny? When the elections came up, my friend said, you better pray The Tories don't get out to Chelsea.
Yeah.
Seems to be getting worse, whether it's health, lack of opportunity,
Hmm.
education attainment is low.
Hmm.
The only thing is high there is the crime.
Keeping the budgets for these services by location, keeping the money in that location
Yeah.
is a way that people who have more get more, people who have less get less. That's a very attractive system for the haves. Feel like their money is going to their community. They like that.
Mm-hmm.
And if you propose, okay, no, we're going to put it all into a single pot and spread it equally, people don't like that. Even if you're purely self-interested, you're better off living in a society that is more equal that way. Because when people are deprived and they are suffering, they're unhealthy, and it leads to all sorts of problems, lack of productivity, crime,
Exactly. Yeah.
and just all these sorts of social problems
Yeah.
that will cost all of us in the end.
Exactly. It would. Should that be at the detriment of the rich?
I guess that's what I guess
Because
that's
is it
what I'm saying
unfair
is
for them to pay extra
I get, even if they pay extra, that's not to their detriment. That's to their gain. Because like you can have all this stuff, but if someone robs you and stabs you, it doesn't matter how much money you had, right? That's to your detriment, right? If you get this massive inequality, you might be very rich, but if you have to live in a fortress and you're worried about your bodyguards, you know, like taking you out,
behind a gate.
then how much better off are you? Why not share a bit of the wealth, make the world a better place, and then everyone's freer, right?
Is health inequalities just about rich versus poor, or are there other factors at play?
There's lots of different factors. The rich versus poor thing, that's a key factor.
Of course.
That's obviously one, but there's so many different factors at work, including, I have to say, lifestyle. I mentioned the Darcy report that identified the problems with the NHS. And one of the things that he identified, and I totally agree with this, is that the general public is not as healthy as it could be. We don't exercise much, we don't eat well, and we probably smoke more than we should. So there's lots of things that we could do to improve our health
Yeah.
that we don't do.
It does cost a lot to go to a gym.
It does. If you compare the rates of these things to different countries, we're not as good as we could be. I think I was saying to you before the episode, or maybe I'm just not remembering. Yes, maybe I've already said this today. The level of obesity in the UK is 30%.
Yeah.
Okay, the level of obesity in Japan is 5.8%. If you have a population less obese than the UK, that's a whole bunch of diabetes and other metabolic problems and heart disease that you don't have to pay for in your health system,
Yeah.
right? So there is a role, I think, for lifestyle factors. And if there's a role for people to play in their own health.
But if they're not in the right mindset,
Yeah.
if their mental health is suffering,
Yes.
all around them, their life is bad. They don't see it. They don't see a way out. They don't see any future.
Hmm.
They've got no hope.
Yeah.
How are they supposed to access services if they're not in the right state of mind? It's easy to say we should be in charge of our own healthcare. Fine. But if all these factors, poverty, low income, no income, high unemployment, mental health, hopelessness, you're just not
Yes.
happy. We don't think about happiness.
Yeah.
If you're suffering from all these things, you're less likely to
Yeah.
access all the services that can help you live a
Yeah.
better lifestyle. You're more likely to smoke.
Hmm.
I used to smoke myself.
Hmm.
Probably drink. Could end up taking drugs. It's a factor that a lot of people are living that way. Not because they've always dreamt that's the lifestyle that they've wanted,
Yeah.
but because something has happened in their lives. We're not all blessed to be born into a certain household
Yeah.
where we haven't had to want for anything, that we haven't had to fight for equality. We haven't
Hmm.
had to fight to get an opportunity to get a job,
Yeah.
that good health, decent home. We haven't had
Hmm.
to fight for those things. But some people do. Some people are born into horrendous conditions. Some people don't know their parents give them up. They're sexually abused at a young age. Even before they get to that age of being an adult, their life is messed up. And the services, we know that there's a problem with children that come out of the care system. When we look at what happened in the North with the grooming gangs, who cared about those young kids? The police didn't. So we can say all these factors until we're blue in the face.
Hmm.
If we are not taking care of individuals before they reach a certain age, is it 7? They say, see, at 7, you see the man, you see the woman. If
Hmm.
we are not taking care of them before that age, they are more likely to go the route we don't want them to go. If a child is being raised in a care home, once they get to a certain age, they're told to leave.
Yeah.
Where are they going to
Yeah.
problems? If they've had issues while in care, have they
Hmm.
had the resources to help with that?
Yeah.
So it's all right giving them a roof and a bed.
Hmm.
What have you done with their mental health, their well-being, their self-esteem? And this is
And
why it's so easy for men like that to pounce on these young girls. So if you notice, only certain type of girls, they go for the ones that are vulnerable,
yeah,
that
they love bomb one.
need
Yeah.
someone just to say, I will care for you, I will look after you. Everybody else, they've turned their backs on you.
Yeah. My statement before about needing to make better lifestyle choices,
Mhm.
at no point am I blaming people for the bad things that
Oh, no,
have
no, no,
happened
no,
to
no.
them. Sometimes with my patients, I make the distinction between fault and responsibility. Those are two words we often use as if they're the same, right?
Yeah,
What's the difference between fault and responsibility? Fault is looking at the past. Why did this happen? Whose fault
yeah,
is it?
yeah,
And sometimes we say who's responsible, and what we mean is whose fault. But when you
yeah,
say who's responsible, you mean who's going to fix it? What caused it and who's going to fix it are two different questions. We confuse the two because we say the onus is on the person who made the mess to clean it up, right? Sometimes that doesn't happen. Sometimes you're in a point in your life where it's not your fault. You didn't make the choice to be abused or to
yeah,
grow up in a certain area, but
yeah,
it's your life and you're the only one who can change it.
yeah,
The classic example is if you're walking down the street minding your own business and you get hit by a car and now you're in a wheelchair. Whose fault is it? The driver. Who's responsible for your life? It's you. How you live your life from then on. You have to learn to live or learn
yeah.
to walk again. That's a tough road that you didn't ask for,
Mhm,
but you're the
mhm.
only one who can walk it.
That takes a lot of support. That's what we're lacking. I'll give you an
Mhm.
example. We're always told about community. We should look out for one another.
Mhm.
But where I live, there's a man who's got mental health issues.
Mhm.
We had an episode. I called the mental health team. They know who he is.
Yes.
But because I wasn't a relative, they couldn't do anything. So I said to the woman, he jumped in front of a fire engine on a 999 call. He's a danger to himself. They
Right.
still wouldn't act.
Because you
And
weren't a relative.
I am a concerned neighbor witnessing somebody having a breakdown. It's not nice to see.
So they
And
wouldn't send anyone to check on him or do a welfare check?
no, this
That's crazy.
person is unlikely to pick up the phone and say, I'm having a breakdown. Very
Mhm.
unlikely.
Yeah.
So people do it for them. I'm alerting you. I'm telling you,
Mhm.
he could end up hurting himself or hurt someone else. He could have crashed. Eventually, we had to call the police.
Hmm.
Of course, he goes to A&E. Why? Why? It makes no bloody... It's ridiculous. They know him. He's well known. So they knew who I was on about. I couldn't give information like date of birth, but they knew who I was on about. It's not like they didn't know. They knew. I said, I don't need to know his history. I don't need to know his business, but I'm informing you. This is what's going on for over a few days. And something needs to be done. They wouldn't do anything. Accessing services
Yeah.
and
Accessing
receiving
services.
services are two
Yeah.
bloody different things. So don't write your
Yeah.
reports saying we don't access. We bloody well access.
Yeah. The level of social support he had and the perceived social support. But for people who don't know, I did a whole PhD on stress. And one of the things we looked at is the effect of social support on stress and health outcomes. What's really important is perceived social support.
Mhm.
You can have social support, but if you don't perceive yourself to be supported, then you're just as stressed as if you didn't have any,
Uh-huh.
right? So it's how well supported you feel that you are has an impact on your stress level, and that impacts on your health.
Mhm. It was just awful.
Yeah.
They're trying to have a handle on social care. Mental health, it shouldn't have to go through A&E. That's not what A&E's for. It shouldn't have to
No.
go through the police. That's not what the police are for.
Did you hear the announcement yesterday?
That the 10 hospital trusts have been piloting new assessment centres to deal with people experiencing a mental health crisis. The aim
Yeah.
is to get patients to appropriate care in a calm environment, avoiding long waits in A&E. I've
Yeah.
even heard of people with a noose round their neck sitting in A&E. How is that?
Yeah.
They said there's going to be 10.
There's 10 trialing it, and they
Sorry.
want to roll it out across the UK over the next 10 years. They haven't done anything yet. They're just announcing this is what they're going to do. And there is this trial.
There should be a separate space
There should be a separate
where
space.
there are
Yeah.
specialist mental health care team 24/7, because person's breakdown might not be between 9 and 5, I'm sorry to say. It needs to be a separate space in all if there are any A&Es left.
Yeah.
Where-
I can't remember if I told this story before. I once had a patient who came to their session with me. This is back in Canada. And they said they're suicidal. And they exclaimed that if I let them go home, they were going to go home and kill themselves. So at that point, it's time to
Mhm.
go to A&E. And I might normally call an ambulance, but I happened just to be across the street from the A&E. So what I did was I walked the patient over for them to be immediately assessed, or so I thought. So we arrived and it was full, and a very overworked nurse or clerk, when they heard I'm a psychologist, I'm here with my patient who's telling me that they're going to kill themselves and they've already done this. They didn't quite roll their eyes, but they just exasperatedly said, okay, sit over there. When people with mental health problems show up in A&E, they do need emergency care because they're going to do something to themselves. But
Yeah.
from the point of view of the A&E staff, they're looking at this. We've got people who want to live and are dying, and we need to help them right now. We don't have time for people who are doing this to themselves.
We have spoken about health.
Yeah.
Health incorporates not just physical pain, mental pain.
Yeah.
True, they should be seen.
They should be.
Really?
And maybe the exasperated nurse or surgeon doesn't need to be doing that, but they do need to have dedicated services that can see them urgently, because that is an aspect of healthcare that is an unmet need.
Right. So we've talked about the main drivers: poverty, housing, education, no money, no hope, no access. We've looked at rich versus poor. We know that it's much bigger than that. A very complex, which is why I think government after government
Hmm.
haven't got a grip on
Yeah.
health in this country. Social care seems to be the hardest one.
Yeah.
So it's not as cut and dry as people think. Take politicians out of the picture, hand over the Department of Health to clinicians. Just it's not working in
Yeah.
politicians' hands.
Solving complex problems starts at the beginning. You do one thing and you take care of that and then move on to the next. While looking at the social determinants of health, I found a pie chart that looked at is looking at all the factors that contribute to individual health. And according to this pie chart, it's only 10 or 11% of your health that's directly related to the medical care you receive. There's all these other factors that contribute to your health. Yes, there's the role for government and funding in the AHS, but there's a whole lot of other things that are contributing to people's health that
Mhm, mhm.
need to be tackled from different angles. So you can't solve it all at once, but you can do a kind of a piecemeal approach of little by little taking a bite out of this and a bite out of that, and gradually things improve.
But also something we mentioned, we did an episode on prescription charges. So if
Yeah.
you're living in a deprived area,
Hmm.
earning over the threshold, you have to pay for your medication. People with asthma have to pay for inhalers and everything.
Hmm.
And if a mum, children, she's just about managing, but she's going without her inhalers in order to feed herself and her kids, she's more likely to get ill.
Yeah.
The health inequality it also covers prescriptions to keep you well, to keep you out of A&E.
Yeah.
I don't know, it's complex. I don't work in health. I'm going to think about it as a layman. There just seems so many things that could be solved. People in the poorest areas live 7 to 9 years fewer on average than people who live in a rich area, in a more
Yeah.
affluent
That's
part
on
of the country.
average.
On
Yeah.
average.
Yeah. Yeah.
Okay? When's the last time you saw a person who's a beast who's rich?
I'm trying to think.
It's quite rare.
No, you don't.
It's
I
quite
can't
rare.
think of it.
They can buy better healthcare.
Yeah.
They can get access to the slimming pills
Yeah.
without having to sit there waiting for the
That's
NHS.
true.
They can buy better food, better everything's better skincare, better this,
Yeah.
better that.
I
So
mean, I suppose
money
someone
does
like
give you access to better healthcare.
I was wondering if
Does.
Warren Buffett, do you know who that is?
No.
He's very old now. He's a billionaire investment guy, owner of Berkshire Hathaway.
Everyone's
Um,
looking trim. Since
everyone
Ozempic,
everyone's looking
I'm
trim.
slim and trim. Look at Oprah. All the
That's
years she tried to lose weight, and all of a sudden, spokesperson
yeah.
for WW, this magic injection or pill comes in, and all of a sudden the woman looks trim and fine. Come
Yeah.
on. You're rich, or have
That
available funds.
that's funny because we call rich people fat cats.
Can't call
But
him that now.
but how many fat billionaires are there? Not many with
I know, you
Ozempic, I
can't call
suppose.
him
Yeah.
that. My biggest gripe is when they take it and then they go on TV,
Yeah.
lecture us and say how bad it was. Don't take it. But you are the size you want to be. You've lost your weight.
Mhm.
That's going to bring down the risk of obesity, heart disease, the risk if you're having a stroke and all those things. That's what they say. I remember this movie. I can't remember what it's called.
Hmm.
I remember the name of it. And Uglies. They were divided into people that look good and people that didn't look so good.
Okay.
Uglies. It was with Jolie King. These futuristic movies in the future
Right.
or
Okay.
whatever. And it was about them, I think they had to take a pill or something, and they
Right.
become beautiful.
They look good and healthy.
But the whole point is,
Mhm.
we seem to be having people that can access that magic, let's call it a magic potion.
Yeah.
Everybody wants it. But if you haven't got the money, you can't get it.
Hmm.
Okay. And you've got to be a certain BMI.
Hmm.
But yet, if you're near that, I could do with it, you're not going to get it. But you can't afford to buy it. And even the ones that can afford to buy it, they aren't near that BMI. They just want to look good. Nothing wrong with that.
Hmm.
But we've got this two-tier system again.
Yeah.
And it comes with how people look. You've got a group that can look good, be the size they would like, but you, mere mortals, can't have that.
Hmm.
There's a clear difference with how we are looking.
So it affects how you get
Does.
treated,
It
you
does.
get a job.
I was watching this
Yeah.
show the other day,
Mhm.
and someone was talking about that they were treated differently when they lost weight.
Yeah.
No, beautiful people get treated differently
Hmm.
to people not in that beautiful box. I'll probably be in that box. Oh, I
Yeah.
like how you didn't even say, "Oh, Val, you're not that ugly." I like that.
No, no, I don't think of you as obese. I was thinking, I had a prior supervisor, a very big woman, and we were having a conversation. She was talking about the way she gets treated as someone who's very obese.
Yeah.
People would literally yell out to her as she walked down the street in ways that would never occur to me.
Yeah,
She said guys in cars would drive by and yell,
yeah,
"You're fat." And
yeah.
I know. Or when she was walking into her GP office, the guy coming out just said, "You fat?" and kept on walking.
They can
Random
just say it. Yeah,
comments is something people who are very obese have to live with,
yeah.
these little comments. So it's no wonder it affects mental health. It was quite stunning to me, the way she got treated.
They roll down the window of their car and they shout. Yeah,
Mm.
it's awful. They do it all the time
Yeah.
because they think they can. Look at that singer. What's her name? Who was all for image positivity. Well, you know that singer. Oh, you probably don't listen to music. Do you listen to music?
I listen to music,
What kind
but
of music do you listen to?
I listen to rock and roll, jazz,
L-
blues.
Do you remember Lizzo?
Lizzo, okay. I know Lizzo.
Okay, so
I've
you know her.
talked to people about Lizzo,
Yeah,
body positivity.
has lost a lot of weight.
How
Yeah.
positive were her followers after that?
I don't really follow her, but I saw a picture of her
Yeah.
online and bloody hell.
So why did she want to lose weight if she was about body
Look,
positivity?
I don't know. How can I say this?
Did she get healthier?
Some people were going about body positivity because can't lose weight. And then the potion arrives where people can lose weight overnight without going to the gym, without lifting any weights. I don't know if she used it. Some people are saying that she did. But yeah, she's lost
Okay,
a lot of weight.
right.
Is she still into body positivity? I don't know. It's accessible.
If you can afford it, you get Ozempic. If you can't, you get body positivity.
Let's talk about this. How are health inequalities measured?
That's a good question. We often talk about lifespan, like we talked about in this episode,
Yeah.
right? So measuring how well things are, or we talk about mother-infant mortality rates.
Yeah.
Yeah. Obviously, the incidence of certain kinds of diseases, but
Mhm.
also the outcomes, how well they're treated
Yeah.
or not. So there's various ways of measuring it. And I think just talking about all the complicated factors, I think the problem is it's not as simple as just saying these are the groups in society, here's the proportion of the population,
Yeah.
and they're having a different outcome. So therefore,
Mhm.
inequality. It's really about trying to look at the impact of these unfair, uncontrollable factors that are influencing health
Mm.
and teasing it apart from all the other factors.
Yeah.
So it is a more complicated question than just looking at a single analysis.
So do stats alone, do they tell the whole story?
It depends on the stats you look at. So I think another thing, because I used to teach research methods and statistics at a university. And I think one thing that we learned is like when people are looking for a cause and effect relationship,
Yeah.
we all like a simple main effect, right? This thing causes that, right?
Yeah.
If I water my flowers, they'll grow bigger. But
Mhm.
oftentimes, it's not a single factor, it's an interaction, right? So it's not like just the more water you put on your flowers, it always gets bigger.
Yeah.
Because if there's not enough sunlight, the
Exactly.
flowers aren't going to grow. So
Yeah.
what you actually need is for the best impact, you need there's a main effect of sun and a main effect of water. But if you have the two of them together, you get this exponential growth, right? And then if you add in other factors, really three
Mhm.
factors, three interact like a kind of a two-way or maybe a three-way interaction
Yeah.
is the maximum that a human brain can comprehend,
Uh,
right? So you could say like sun and water in this case will make flowers get bigger, but in this
yes.
case, you can have a different effect. You can almost understand one step beyond that, but it's pretty hard. And when we're talking about health, we're talking
Mhm.
about really many factors. And so the only way to look at it
Mm.
is to take the information we have about the different factors and try to hold them constant and say, if we isolate this variable, what's the impact of this?
But then it's
That just makes it easier to understand, but it isn't the
mhm,
whole
mhm.
picture, right?
But the human being, do you know what I mean? It's okay. It's like they say when somebody goes in for an operation,
Hmm.
okay, they occupy that bed for a few hours, then they leave. We know somebody like my son who's got sickle cell,
Hmm.
before he can have an operation, does he need to be transfused? How long does he need to stay? Who else does he need to see? But it's not just being in bed and what. There are other things involved. Despite we have these stats, we are complicated. We are individuals, which is why when they say things like in their reports, person-centered NHS, they can't even get the basics right. So if you can't get the basics right, how are you going to personalize something for each individual? It doesn't make sense. Let's get some things right. It's got to be social care. Get the list
Yeah.
downs, and social care will help drive down people going into A&E. It will help that. But you've got to look at the deprived areas and resource them better. If you don't resource them better, A&Es are going to be overflowing.
Yeah.
We know winter isn't one of the, oh my God, it's winter. It happens every year.
Yeah.
It's like Christmas. It shouldn't be a surprise. And we know each year the flu, it's different every year. We know certain people with certain illnesses, the vulnerable, the young, the very old. We already know this. So why are we not already looking at certain areas that do have an influx of more people in winter? Why aren't we already looking at those areas? I don't know if they are or they're not,
Mm.
but resourcing them better. If you've got to take a resource away from an affluent area that doesn't need it, but a deprived area does, they need it more. It shouldn't be about, okay, but we're in power and we're only going to look after the areas that voted for us. Whoever is in power should be looking after the UK, regardless of whether this area voted you in overwhelmingly or this
Hmm.
area doesn't. Starving of
Yeah.
resources. You don't need any more stats. You don't need any more reports.
Regardless of which reports get written, I guess I would just come back to this idea of do you want to make changes that benefit the people who need it most, bring people up to the same level? Or if there's an inequality, do you want to just put it and strive for helping the already healthy get healthier? I don't think so. You
Yeah.
get more benefit from helping the people at the bottom.
What normally happens after a health inequalities report,
Yeah.
the health inequality widens. I don't know if that's the universe telling us anything. The whole story goes beyond just the stats.
Yeah.
We are talking about human lives. We talked about communities, young girls raised in children's homes, thrown out at a certain age, different communities, traveling communities, ethnic minorities, women, men, across the board. Life expectancy isn't too good. between the deprived and the, what do you call it,
Yeah.
the affluent.
Okay.
They say it's
Yeah.
between 7 to 9 years.
Hmm.
They said black women in the UK are 3 to 4 times more likely to die in childbirth than white women. I thought it was just giving birth. It's a baby. It's a woman's body. My body's the
Yeah.
same, just a different colour. Why should it be any different for me? It doesn't make sense to me as
Hmm.
a woman who is going to give birth and another woman beside me who happens to be white. She's still a woman. We're both pregnant. We're both going in to give birth. Why should her experience be better than mine? Why is it I'm more likely to die? These are the things that create more inequality.
Yeah. That's a really good question. And I think if we want the answer, we need to look at all these factors and figure out the unfair, controllable inequalities, the factors that contributed and that we can do something about.
I'm getting pressed. Luckily, I
Yeah.
can't get pregnant anymore. It's
No.
horrible to read
Yeah. Yeah.
because when you see it in, pardon the point, black and white, you
Yeah.
think, my first question is, what? Why? No, it doesn't make sense. I want to know why
Yeah.
these things happen to correct them for the next generation. We're not going away. I'm not going to wake
Yeah.
up white tomorrow.
No.
So we know language barrier is an issue. We know cultural are issues.
Hmm.
Even though I'm born here, it doesn't say, as I'm reading the stats, it doesn't say it's because you're not born here. But I've heard stories of black women born here having loads of problems. You black women, you're built with a pain. Some of those comments are made. You'll be
Yeah.
fine. Or you just ignored. You hear of that. Where I gave birth, I went home. So you can imagine I was the only black woman in the whole of the place.
Hmm.
The nurse made a comment. Oh, we can't mix up your baby.
Yeah. They won't.
I wish
Yeah.
they did. I'm joking. No, I was too exhausted to even give a damn. And the next question was, do you want it with your... I was like, no, I've got the next 18 years. They're unlikely to mix him up. It's the only black baby born
Yeah.
that year, I think.
Yes.
Honestly. And
Yeah.
now he's 31. He's still
Yeah.
living at home. That was the only thing said.
Yeah.
She wasn't being horrible. She wasn't being rude. It was a bit of a laugh, but I was
Yeah.
too tired to laugh.
Yeah.
I didn't take it anything.
Yeah.
Health inequalities are about far more than personal choice. They're built into the structure of our society. To challenge them, we have to name them clearly and often.
Absolutely.
Okay, let's do our stories, labels, and misconceptions for this episode. If you had to summarize
Yeah.
the story of inequality in one word or phrase, what would it be?
Oh, you mean like inequality in health? I'm not sure. I think for this episode, the
Yeah,
one
for
word,
this.
it's deprived.
The word you learned
Deprived.
today.
The word we came across because in the UK at least seems to be driving inequality is the
Yeah.
deprivation.
This episode is about exposure, the way inequality is hidden in plain sight,
Hmm.
in systems that say they're fair. But we know it's not.
Yeah. Well,
It's
it's unfair in subtle ways we don't often appreciate.
Okay. So what's the label you think society wrongly places on people who live with poor health outcomes? And I think you said something in the episode, and I wonder if you're going to say it now.
The label, I think we talked about people being hard to reach or that a label of kind of, I don't know, disengaged or that they're responsible for their own care or their own lack of health,
Yeah.
their fault.
Yeah. Yeah.
Right?
Yeah. The onus is on them, their non-compliance. So the misconception, what they got wrong. What is the biggest misconception about health inequality?
Probably that it's simple. It's not simple. It's
I
complicated. It's
thought it was
subtle.
simple.
It's yeah, I think we're all tempted to think of it in a very simplistic way.
Mhm.
We all imagine we could fix it, but I think the truth is it is just complicated. There's probably multiple solutions that all need to be that will fix a part but won't fix the whole thing. So we
Yeah,
need to do them all.
yeah.
And we all have a role. So there is a role for change and differences in the NHS
Mhm,
and or
mhm.
government funding, but there's also a role for other institutions in society and individuals too. And again, it's not because it's all their fault, right? But to be responsible is to have the ability to respond. If you have the ability to respond, you're responsible.
Mhm, mhm.
So I think it's going to take a collective response.
Yeah. I think the biggest misconception we've challenged today is the idea that everyone starts on the same page. As we talked about that before, where you're
Hmm.
born into, your outcomes, blah, blah, blah. Or that the NHS alone can fix it. I think it takes a lot more than the NHS alone.
Hmm.
It's gonna as we said, it takes a village.
Yeah.
The NHS alone is not a village. It can provide us the resources, things like that, but
Hmm.
it's gonna take a lot more than that. We as the people, we as human beings, we have to be willing to comply
Yes.
to make our lives better. But we know that some people can't because they're in a place in their mindset where they're not able to get to the state where they are able to comply. Therefore, the NHS needs to provide those resources to get everybody on that same page where we can all comply.
Yeah.
Yeah?
Thanks for listening,
I did.
everyone.
I enjoyed today because I do talk about health inequalities, but it's complex. It really is. When
Hmm.
you think one thing, something else pops up and it's not as easy as you think it is.
Hmm.
So I'm going to learn something
Yeah.
along the way as well.
Yeah.
So that's going to be good for me.
Yeah.
As we said in the beginning, this was part one of a series on health inequalities. This was just about laying the groundwork. Next week is what, Dr. Jeremy? Would you like to say what we're talking about?
So, next episode, we're going to be looking more carefully at social determinants of health, in particular, the social determinants that affect health inequalities.
Brilliant. Okay, now you can say it. The thing that you've been dying to say. You can follow us somewhere. You can say it, and it's true.
Yes, you can follow us on Facebook, Instagram, Twitter,
That was the one.
although Twitter is now called X.
Thank you. Thank you for listening. We hope you enjoyed today. We've had a laugh. Okay, some of the things we talked about, but depressing. So, I'm tired. See you next.
Okay.
Hope you
Take care,
enjoyed
Val.
today. See you next
I
week.
did. See you next week, Val.
Bye.
Bye bye.